And then I'm going to go ahead and palpate your lymph nodes. So pre-auricular, post-auricular, occipital, submental, submandibular, tonsillar, superficial cervical, posterior cervical. Can I have you go like this? Deep cervical, and then on the other side, deep cervical, and then kind of hunch forward. Supraclavicular. So none of the patient's lymph nodes were able to be felt, which is a normal finding. If I did feel them, they would be pea-sized and be able to move. And then, have you had any problems with your lymph nodes? Notice any swelling, anything like that? Mm-mm. Okay. So then, I want you to smile for me, puff up your cheeks, and raise your eyebrows. Okay, so the patient was able to do that all symmetrically. So her cranial nerve number 7 is intact. And then I'm going to move to your nose, okay? Good. So inside the patient's nose, she does have a little bit of a deviated septum. There's evenly distributed hair growth. The turbulence in the back were good, pink and moist. You have no problems with your nose, any altered smells? No. Okay, if there was altered smells, I'd have the patient smell something that's checking cranial nerve number 1. And then pink and moist, a little bit of a, has that given you any problems, a little bit of a deviated septum? No. No. Okay. And then the nose is symmetrical. The nares are equally bilateral. I'm going to have you go like this and for me. Good. Other side. Good. So that's a normal finding. The nose has patency in both nostrils. Then I'm going to move on to your mouth. Can you open up for me? I'm just going to take a look inside. Can you stick your tongue out and say ah? Ah. Good. And then I want you to just swallow a little bit. Good. And then stick your tongue out again and say ah? Ah. Good. So by doing that, the patient's cranial nerves 9 and 10 are intact by her being able to stick out her tongue and say ah, and then being able to swallow. The soft palate moves towards the back. And open up again. Can you move your tongue to this side, and then to the roof of your mouth? Good. So inside the mouth, the pharyngeal wall, the mucosa, the gums were all pink and moist. The tongue was pink and moist. Her tonsils weren't touching, so I would grade them a +1. The uvula was pink and moist. All teeth seem to be intact. Do you struggle with bleeding gums? Nope. And when's the last time you saw your dentist?
About 3 months ago.
3 months ago. And then, do you smoke?
No.
Do you drink?
Occasionally. About how many times a month would you say? 3.
3? Okay. Is it a concern to you or others you're drinking?
No.
Okay. And then, can you repeat light, tight, dynamite to me?
Light, tight, dynamite.
Okay, so cranial nerve number 12 is intact. Okay, so then I'm going to move to your ears. So, looking at the patient's ears, they are equally bilateral and parallel to the canthus of the eye. Do you have your ears pierced?
Yes.
Okay, so the patient does have piercings in her ears. There is a healthy amount of earwax in both ears. If I had an otoscope, I would look into the patient's ears and observe the eardrum, the tympanic membrane. Have you noticed any recent hearing loss?
No.
And you said you didn't have tubes in your ears when you were little?
No.
There were no foreign objects in the ears. When you clean your ears, do you use Q-tips?
Yes.
You should try and use a washcloth instead. And then, so I'm going to have you stand up for me, face that wall, and close your eyes.
So I'm doing the Romberg test, and the patient is not swaying, her balance is good, and then I want you to point to which side you hear this in. Good. Good. So patient's cranial nerve number 8 is intact. So you can take a seat for me. And then moving on to the neck, I'm gonna have you put resistance on my hands, lift up. Yeah, good, and then push against my, good. Good, so cranial nerve number 11 is intact. While I'm here, I'm gonna check the patient's turgor. And the turgor goes back within less than 3 seconds, so the patient is hydrated. Next, so I'm just reviewing my cranial nerves. Cranial nerve number 1 is if my patient had altered smell, I'd have her smell something. She said she hasn't. Cranial nerve number 2 was the Snellen eye chart I would do. Cranials 3, 4, and 6 was the movement of the patient's eyes without any involuntary movements. 5 was opening and closing the jaw and touching the face, the patient being able to feel that. 7 was puffing up her cheeks, smiling, and raising her eyebrows. She did symmetrically, which cranial nerve 7 was intact. 8 was the whisper test and the Romberg test. 9 was being able to swallow and her soft palate move. 10 was sticking out her tongue and saying ah. 11 was the shoulder resistance and the neck strength. And 12 was repeating light, tight dynamite back to me. So the cranial nerves were all intact. So then I'm going to move to your posterior back. So I'm going to have you turn. You just lift it up? Yeah. Okay. And I'll move it. So just looking and inspecting the patient's back. She does have 2 tattoos. They're not raised. There's no infection. Her skin is warm and dry. I see no lesions, no macules to be concerned with. The skin is appropriate for her ethnicity. I'm going to map out my patient's lung field by going to her her C7 down to the end of her scapula, which would be here at T7, go down to T10. I'm gonna lift this up a little bit. So here, and then when I'm here, I'm going to go in and pinch, and I want you to take a deep breath for me. Good. So my hands move symmetric, so the patient symmetrical expansion. I'm also going to note the AP diameter. So her AP diameter is 1 to 2. Do you have any back pain or trouble breathing?
No.
No? Okay. So then I'm going to just palpate the lung fields. I'm trying to feel for crepitus, which is like a Rice Krispie feeling through the skin. So the patient has no crepitus. Then I am going to have you repeat 99 to me, okay?
99.
Good.
99.
Good.
99.
Good.
99. 99.
Good. So the patient's vibrations diminished as I went down, which is a normal finding. Then I'm going to percuss the lung fields. So I'm listening for a resonant sound, which I heard. And then I went from C7 to, again, T10 over to the lateral lung fields, T8 and T6. And then now I'm going to auscultate using the diaphragm. And now every time that I move my stethoscope, I want you to take a deep breath for me, in and out, okay?
Okay.
Okay, last one. You doing okay?
Yep.
Okay, so the lung sounds were clear. There was no wheezing, rhonchi, or crackles heard. No crepitus. Tactile phragmitis was good. Okay.